Hello guys, we are here with our second lecture and it is on the F phase. Before starting it, I have a question for you, and the question is, you have a patient of trauma which that patient arrives in the casualty and patient is cold, pale. He has BP of 90/60, heart rate of 120 and GCS of 14. So my question is your patient is in anabolic phase, is he in ebb phase, flow phase or convalescent phase? Okay, at the end of this lecture we will get our answer. Now, what exactly F phase is? F phase is immediate, short-lived phase that follows the injury. Okay, so after injury, your body flows through certain phases, and these phases are divided into three. First is F phase, second is flow phase. Okay, again we divide flow phase into two phases: catabolic phase and anabolic phase. Okay, and after that actual recovery starts. Okay, so F phase is the immediate phase immediately after injury, after trauma, after surgery, after sepsis. Okay, your body goes into F phase. Now imagine this F phase as body is going for meditation, for silence retreat. Okay, so that is the reason in F phase body tries to give everything to the vital organs. And who are the, like, which are the vital organs? First brain and then heart. Okay, so body tries to conserve the energy and give everything the body has to brain and to heart. Okay, so if this is the situation, then what will happen? Obviously the skin or the blood going through the skin to the skin will get diverted to heart, to the central organs, and that is the reason your patient will be pale there, and he will be cold. Okay, due to vasoconstriction. Now let's see theoretically what F phase is. F phase is the immediate phase. It is short lived phase. It lives around 24 to 48 hours after injury if you are resuscitating your patient properly. But if your resuscitation fails, then this F phase will get prolonged and patient might lead to, like, your patient may have consequence of death due to this prolonged F phase. Okay, so we are seeing that F phase is immediate, it is short lived, and it follows injury. It is characterized by fall in metabolic rate. Okay, BMR will be less, then there will be hypovolemia. Why? Because patient has trauma, he might have bleeding, he might have third space loss. Okay, so patient will have hypovolemia and hemodynamic instability. And everything body is now doing is to conserve fluid, conserve blood, conserve hypovolemia, and conserve energy. Okay, so who is that great person who coined this term? And he was Cutterston. Okay, he was the scientist who first time coined this term F phase, and who is the one actually who categorized this area after injury into ebb, flow, and fat gain phase. Okay, let's see. F phase is first phase after injury. It is after 0 to 24 and maximum it gets prolonged to 48 hours. Okay, now after that comes flow phase. Flow phase is again we divide into catabolic and anabolic phase. Okay, flow phase is for 3 to 10 days. Flow catabolic phase. Flow anabolic phase will be there for 10 days to weeks. So phase will be there for hours. Flow phase catabolic will be there for days. Flow phase anabolic will be there for weeks, and after that fat gain will start and it will be there for weeks to months. Okay, so this is the whole crisp of this lecture. Okay, now F phase we have already discussed. It is immediate phase. It will last only for 24 to 48 hours. Then it ends when resuscitation is stored by perfusion. Okay, and that is the turning point when this F phase is getting converted into flow phase. Now what will happen if F phase is getting prolonged? If it is getting prolonged, then it means it has patient has poor resuscitation and there is high chance of mortality. Okay, now let's see what actually happens practically in the body when patient is in the F phase. Your cardiac output will be low. Why? Because body is in hypovolemia. Okay, if cardiac output is low, body tries to conserve that fluid. And how? Because body tries to decrease urine output by sending hypothalamo pituitary axis by stimulating it, and after that ADH will get secreted, aldosterone will get secreted. What will ADH do? ADH will conserve the water. What aldosterone will do? It will conserve sodium and potassium, sorry, sodium and water. Okay, ADH will conserve water, aldosterone will conserve sodium and water. Now along with ADH and aldosterone, there are another changes getting there in the body, and what is that? There is activation of the sympathetic system, and due to this activation of sympathetic system, there will be peripheral vasoconstriction. Okay, and what that peripheral vasoconstriction will cause? It will cause it will cause cold clammy skin, and body tries to increase body tries to increase systemic vascular resistance. Okay, and that will result into increased blood flow towards the heart. Now first thing, cardiac output will be less, then body is temperature will be less because of vasoconstriction at the skin level. We already discussed why and how. Then third will be, there will be decreased blood pressure due to hypovolemia. Then your metabolic rate will be low. Why? Because body is trying to conserve the energy. He is trying to use as much as less for the peripheral organs, and it is trying to utilize it more for the brain and for the heart. Okay, then heart rate will get increased due to stimulation of the sympathetic system. Then SVR will be there, systemic SVR will be there because vasoconstriction will happen and leading to alpha 1 adrenergic receptor activation, which will shunt blood to the vital organs. Okay, so systemic vascular resistance will occur. Now after this, body will need maximum glucose. Okay, so the glycogen stores are now getting converted into glucose. So glycogen will get breakdown to glucose and your blood will have maximum glucose, but at the same time body tries to decrease insulin into the blood. Okay, so insulin will be less and glucose will be high. So do not confuse this with, if patient is having hyperglycemia, how can insulin will be low? It is called as hyperglycemia of injury. So insulin will be less because body doesn't want that glucose at cellular level. Body wants that glucose in the blood. So even if, so that if there is some emergency at that time, brain, heart and some vital organs will use that glucose. Okay, so next thing, lactate will be up because when body is trying to conserve the energy, oxygen will be used at the lesser level, but there will be anaerobic respiration which will cause increased lactate level into the blood. Now use your logic and remember this: if patient is hypovolemic and there is decreased venous return and decreased cardiac output, then body responds with sympathetic surge by increasing heart rate and by increasing systemic vascular resistance. Okay, so there will be tissue hypoperfusion and increased lactate. Okay, so if that is the reason, if now someone says, or you got the question in your exam saying that your patient is cold clammy within 24 hours of injury, within 24 hours of surgery, patient is tachycardiac and lactate is more than 2, blindly say that your patient is in F phase. Okay, and that is the reason now you need to resuscitate him, so that F phase will get converted into flow phase. There are three pillars on which this phase will respond, and these three pillars are neural, endocrine, and cytokine. Okay, what will happen at neural level? There will be sympathetic surge. Okay, so after sympathetic surge, from T1 to L2, sympathetic receptors will get stimulated, and they will cause stimulation of hypothalamo-pituitary axis. Okay, and it will lead to, if HPA is getting activated, it will cause secretion of ADH, ACTH, ADH from hypothalamus, ACTH from pituitary, and from adrenal there will be secretion of aldosterone. What these hormones will cause? These will cause conservation of body fluid. So there will be fluid retention and decreased renal output, decreased urine output. Okay, and what is the stimulus for the sympathetic system activation? One of them is baroreceptor activation. Okay, and these baroreceptors are situated at carotid aortic level. Okay, and these baroreceptors will cause activation of HPA axis, which will cause ADH, ACTH, and aldosterone release at different level, and which will cause fluid conservation in the body. Now, during this sympathetic pathway stimulation, there will be vagal withdrawal. What is the function of vagus system? It will smoothen the body. It will cause parasympathetic activation, and that is the state when body is in normal state. Okay, so if some person is meditating more, then at that time there is vagal stimulation, but at fight and flight situation one will need that vagal withdrawal, and that vagal withdrawal will cause tachycardia, because body take this ebb phase as fight and flight situation. Okay, now what will happen at endocrine level? I already told you that ACTH will get released, which will increase cortisol in the body. Okay, and cortisol is the fight and flight hormone. Now after that ADH will get released, it will cause water retention. Aldosterone will cause sodium retention. There will be increased glucagon, also glucose, which will cause insulin resistance, as insulin will get decreased. Okay, so body does not need insulin in fight and flight situation. And what are those two hormones which will get reduced in this F phase? These are T3 and T4. Thyroid hormone will be reduced in F phase. Okay, insulin and thyroid hormones will be less in F phase. Mark this point. Now next thing, growth hormones will be increased, because body needs this energy to conserve to survive this fight and flight system. Now cytokines. In cytokines, what will happen? TNF alpha will get released. TNF alpha is the early marker of F phase, and it will cause fever and anorexia. Then interleukin 1 will also cause fever. Okay, interleukin 6, it drives CRP, so that CRP level is increased in F phase. Okay, and it will release fibrinogen. And these are two anti-inflammatory markers, interleukin 8 and interleukin 10. They also will get released in F phase. Now these are the stronger, these cytokines will be more in flow phase, but they get primed in F phase, and these cytokines will again stimulate the nervous system. Okay, now see the coordination. Nervous system will stimulate the endocrine system, and these cytokines will again stimulate the neural system. Now, if your patient is in OT or ICU, what are the right things you do in FS? See, your goal is to resuscitate the patient. Okay, so one need to have goal directed resuscitation. So C for lactate, C for urine output, and SvCO2. Okay, second thing, do not go for the definitive surgery, go for damage control surgery, because body is trying to survive for the vital organs. So you cannot go for definitive surgery, one need to stop at damage control. Okay, third thing, permissive hypotension is important in FS, because if you do overcorrection, then there will be a more chance of bleeding. Okay, because if patient will go to 120 or 130 of systolic BP, then there will be a more chance of bleeding. So permissive hypotension is important if hemorrhage is uncontrolled. Now, active warming is required because it will prevent the patient from lethal triad. Okay, tell me what is lethal triad. Comment in the answer what is lethal triad. Okay, I am waiting for your answer. Then next thing is tranexamic acid is required for this patient within 3 hours, and this is according to crash 2 trials. Do not resuscitate with the inappropriate blood products. One need to give 1:1:1 blood product ratio, and this is FFP, PCV, and third is whole blood. Okay, so it should be there with 1:1:1 ratio. No, this is not whole blood, this is platelet. Okay, now what are the wrong moves in F phase? First is massive crystalloid, and what it will lead to? It will lead to tissue edema and ARDS. Then second thing is aggressive feeding too early. Okay, body is in F phase, and if you are feeding that patient aggressively, then it will lead to ileus and aspiration. Okay, giving beta blockers without addressing the cause, because if patient is tachycardiac, they don't need your beta blockers, they need to find out the cause of that pain, that tachycardia, which might be the pain. Okay, which might be the sepsis. So find out the cause before giving beta blockers, because 99% of the time patient doesn't need beta blocker if patient is having tachycardia in F phase. Okay, now next thing, surgery for non-life threatening lesions in unstable patient is not required. You just go for damage control surgery. Do not ignore lactate and best deficit trends. Okay, the exact value of lactate and best deficit is not important, but their trend is important. Okay, whether they are getting decreased or increased. If your lactate is getting decreased, then you assume that you are resuscitating the patient well. But if lactate is getting increased, even if you are resuscitating, then think of poor resuscitation. You need to go more aggressively, and please avoid patient from hypothermia. Okay, now these are the things one should not ignore in the exam, and these are the traps. Okay, think if your glucose is up and insulin response is down, that doesn't mean that one need to have that doesn't mean that hyperglycemia will be there, because patient is in hyperglycemic state because body needs sugar, and in this F phase insulin will get suppressed, and we call it as diabetes of injury, hyperglycemia of injury. Okay, second thing, BMR is down in case of F phase and not up, because body is trying to conserve the energy, body is in meditating phase. Okay, so BMR will be low. And if your BMR is low, doesn't assume that body is in no response. Body is responding, but quite differently. So F phase is active phase, it is not passive phase. Just because BMR is low, that doesn't mean that body is in passive state. It is active phase. It is trying to protect the vital organs. Okay, and yes, if there is prolonged F phase, that means there is probable chance of death and not recovery. Okay, so the patient should get promoted from ebb to flow phase within 24 to 48 hours. Now, a question for you. Which of the following characteristic of the F phase of the metabolic response to injury? And yeah, without going for the without going to uh, other options, we have the answer as decreased cardiac output and tachycardia. And let's see the other options. Increased basal metabolic rate? No, there will be decreased metabolic rate in F phase. Then negative nitrogen balance will peak. No, not in F phase. Negative nitrogen balance will not peak. Then decreased cardiac output will with tachycardia. We have already seen there will be decreased cardiac output and tachycardia in F phase. Increased insulin sensitivity? No, there will be decreased insulin sensitivity in case of F phase. Okay, now 6 things to remember from this lecture. First is F phase is for first 24 to 48 hours. It starts from 0. It is the first phase and it is immediate phase. Second, in F phase, remember the hemodynamics will be decreased cardiac output, increased heart rate, increased vascular resistance, decreased basal metabolic rate, and decreased temperature. Okay, we need to fight against all of these. Catherton is the scientist who defined the term ebb and flow phase. Okay, glucose will be high but insulin will get suppressed, and we call it as diabetes of injury. And in F phase, our goal is to resuscitate. Okay, and just do damage control surgery. Do not go for definitive surgery. If there is prolonged F phase, think of lethal triad and mortality. Okay, that is for this lecture, and after this we'll proceed with the flow phase in next lecture. Thank you so much for watching.